Welcome, welcome to the Plus Sides Podcast.
Welcome to the plus sides.
We're here. Hey, how you doing? I'm Kim. If you don't know me, that's weird, but I'm Kim because we're in season
Yeah.
3. And this is the Plus Sides Podcast where we talk about kind of all things health and wellness at these days as it pertains
Really
to,
has. Yeah.
yeah, we've really evolved, but it is definitely centered around um, this medication or this class of medications right now called GLP-1 medications and all good things from health that come from that to treat different diseases or disorders. And we are here to learn and to, heal from many of us many years of guilt and shame, and to grow and evolve into whatever the next phase of us is, you know
Yeah.
and we're
Yeah.
glad to have you with us. Are you interested in understanding GLP-1 medications like Ozempic, Wegovy, or Manjaro? Then join us on the Plus Sides Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, or Manjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Manjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together, because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Side.
Introducing Peptide Vite. It's the first daily natural vitamin to help support a reduction in the major side effects of GLP-1s. Peptide Vite supports fatigue, nausea, GI side effects, and promotes better metabolism. It is third-party tested, made in the USA in a FDA-certified facility. Peptide Vite is a game-changer all-in-one daily supplement. Pharmacist and physician formulated to be safe and effective. Use code PLUS20 for 20% off at zennutrients.com.
Here, you have no doubt just heard our amazing commercial and all of our sponsors, which help make everything possible. Thank you for listening. And if you didn't listen, go back and listen. It helps us.
Listen to it all or
It
watch
costs a
it.
lot. It costs a lot to do this. Just go watch.
No, that's okay. That's okay. I just have a question so we see some people develop obesity later in life, and many times people will deduce that to lifestyle. However, can there be genetic elements that develop in adulthood that contribute to obesity?
So, definitely there is genetic obesity. And now science has advanced so much that we even have laboratory testing for DNA to, identify genes that are associated with childhood obesity and adult obesity. So, if we're talking about a genetic component, it's very unlikely that you were like a healthy weight or a low weight your whole life and suddenly you develop obesity in your 30s, 40s, or 50s. That's very unlikely. But because normally genetic obesity starts from 8 years old or even younger, but like during childhood. That said, you still, could develop obesity later on in life. And it doesn't necessarily has to be associated with lifestyle. Lifestyle absolutely plays a gigantic role, but you could definitely have hormonal imbalances. You could have metabolism issues, and you could be on medications that are required for you to take either for mental health that
Right.
promote appetite and eating, and people tend to gain a lot of weight And we all agree that mental health is extremely important. So if those medications are working for you, then there's no reason to stop them. So we just have to treat the obesity part, right? And so we have all of those components that, can be cause of adult obesity. Oh, and we can't ignore menopause too. Perimenopause and menopause,
Oh, yeah.
it's a big thing too.
Mm-hmm.
It is a big thing.
Yeah.
Yeah, I always forget about menopause does really affect quite a bit. I want to say maybe, I think I maybe might be going through it. I don't know, but I have an appointment with my doctor in a few weeks, so I'll figure that out.
So, menopause, you could be perimenopausal for a lot of years, up to 8 years before you actually enter menopause itself. So it's a clinical diagnosis more than anything. It's not so much as a blood work diagnosis, but is, based on symptoms. So, and weight gain does go together with it, especially because fat starts accumulating in your body just by breathing.
Yeah. Things to look forward to, guys.
Yeah. But now we know we can treat it.
Right. Yeah, exactly. We could treat it now. Kim mentioned this before with her son, but with the question that I'm about to ask, of course, with childhood obesity, a lot of us, you mentioned, don't single the children out. So I know I was singled out. I'm sure Kim was singled out. Hey, you can't have this, you can't have that. And then it becomes like sneaking food. That was, from in my story. But in the onset of my teens, I dabbled with bulimia. So what are some of the signs as parents with teens that may or may not, or they may think or be suspicious that their children is suffering from an eating disorder? What sort of signs should parents look for or be aware of if their child is struggling?
Well, the first thing is weight loss, right? When the child is obsessed or focused on losing weight, excessive exercising, counting calories. Children should not be counting calories. You educate children about or adolescents about what's healthy, but calorie obsession is a big problem, and obsessed with their bodies, right? You constantly see them staring at their at mirrors, like seeing how their body looks, and being very conscious of measurements, in your children's body, and it's by paying attention. It's not just like, let's say if you have a child that has overweight or obesity, and suddenly the child is into looking better or like losing weight because all of their friends, weight less than they do, or because that's in, or that's the trend. So you have to pay attention. It's not only like, oh my God, good for you, he's trying to lose weight, she's trying to lose weight. No, you have to pay attention as a parent, because this child could be depriving themselves of calories, and which I see it all the time, the transition from overweight to anorexia and bulimia, and very common, because they try, and they, and this is the negative aspect of social media, because social media is great for educating, but we have all these ridiculous trends, that make non-healthy bodies, attractive for patients with eating disorders that are not aware of all the dangers that this could cause your health. So really, really, you just have to make sure that you know exactly what's going on and talk. You need to talk. You do not assume. You talk to your adolescent and you question, like, what's going on? Like, I noticed you're doing this. You mind sharing with me? What's your strategy? Or what is your child doing? So because not just because like, oh, good for her, she's doing something, and ignore it. And then parents that don't struggle with weight, they're all happy that their child is embracing this like, weight loss phase without even knowing. And suddenly the child has lost an unhealthy amount of weight in a very fast time, screwed up all their hormones, stopped getting their periods if they're girls, and mentally it becomes a huge problem too, because of the fear of gaining the weight back. So it's very tricky. And, I think parents have a lot of responsibility,
Yeah.
you know, especially nowadays when everybody has access to social media, to be able to differentiate what is, you know, an intelligent advice versus a very uneducated, unhealthy advice.
I actually don't let my kid on social media.
Good for you.
I'm going off as long as I possibly can.
And
That's
that's
you know,
the best.
he doesn't have a phone. He has an iPad, and it is all locked down like
Perfect. Perfect. Perfect.
You know,
Don't get me started.
I mean, he's 11. I'm like, how much longer can I make this work? Like,
you could get away for like, you know, a year or two.
I was hoping like effing college, like at this point.
As long as possible, Kim.
Now
As long
that
as
I'm a
possible.
creator on the internet, so I'm like, it's just a cesspool, and I don't want him anywhere near it.
It is,
Yeah.
just because you have time to have another job, right?
I know.
Supervise your
Yeah.
child's social media.
Exactly. Thank God for like all those parental controls that we can do, and
yes.
screen time and blocking, and oh, thank Lord. And although he's so smart, he's gonna figure it out.
And they have friends.
Oh yes,
They're so good at it.
Your
And the
child might not
friends,
have
yeah.
it, but their friends do.
yeah. And it's
No.
like, and that's one thing that's interesting about like my son, especially like being on the spectrum. You know, he very much wants to have a lot of friends, but sometimes the way he connects best is playing games with them, right? So I have to like find a balance, you know. Hopefully, I don't know. Let's just hope I don't screw him up.
You're doing great, Kim. You're doing great.
Yeah.
Easy. Sorry, Kat, go ahead.
No, it's not easy at all.
No.
Piggybacking on that as well, I know that you mentioned not singling the child out. What are the signs of eating disorder? But in I guess in a perfect world, if you are experiencing like a child who's struggling with obesity, it's advised that you should make it a family affair versus singling the kid out. Like, let's all have oranges today. Let's do this. You know, what are some of the benefits that we've seen? I honestly, I don't think I've even seen a family do that. Well, from my childhood and on up. But what are some of the benefits that we've discovered by using that approach? And
so, I mean, I encourage, especially my adolescent patients, I encourage the parents or the children or my patients that are, you know, young, because first, it's a family affair, right? It's not about you. It's about all of us being healthy, right? And then you cannot expect your child to eat something and you're eating a different meal. So if you want this to be comfortable, and try to avoid the emotional baggage that it comes with having, you know, obesity too. So your house should feel like a safe place.
Okay.
Right. And then if everybody's on board, it will feel as a safe place. And also, I think it promotes a good self-esteem. You know, you feel supported, and people relate to what you're going through also. You know, but it's hard, and especially if you have more than one child, because there's always that, like, you know, fighting between children, or why I want this, why can't we have that, or because of you. So it takes a lot of communication.
Interesting.
But it is the right approach, and I would say it's the right approach for any age, because I also have a lot of couples as patients, and you know, I love when they go through this journey together. Because it really solidifies, instead of like, you know, you're going on this journey on your own, and then you have your partner or your friends, you know, like having not so healthy habits, and you're basically swimming the other way. So it actually, I think that's an approach that it's, you know, for every age.
I do like the idea of thinking about it as, I was thinking as you were saying that, like, when we talk about health, I think it's very easy when you have obesity to center the health around food, what you ingest versus what you don't. But really, having activities as a family is also very healthy, right? Instead of let's sitting on our devices today, why don't we all go and watch a movie on the green, right? Or let's just go out in general. Even if we go watch a movie somewhere, let's maybe go to where there's a playground or a place that we can sit after. Let's go walk around the Avalon or whatever it is, right? Like, and that's going to be healthy because we're going to move our bodies, and we're also going to, it'll be outside into the world with the IRL people and not all the digital people,
IRL.
I just thought that, I just thought like
Yeah.
that would be good. You think I'm kidding, but in my life, I have podcast time and TikTok time, and then I have IRL. And that's my life with my like family and friends and all the 3-dimensional folks.
Yeah.
The difference is, Kat, like you're both, so
Right.
but like there are like, even as an adult, like the boundaries that I have to set down for that are important,
Yeah.
But I just was thinking that was kind of a good way. Like we're all going to have oranges and let's all go do something today. Like maybe it's a go do, we can still have time when we go sit and go do. But I think try to implement that. It's such a good tip. Thank you.
Yeah,
I
love
think
that
it also could help. I'm thinking of activity and then nutrition, but also upstairs. So if you are catching your children speaking down about their bodies and whatnot, that's something for you to say, hey, you know what? You are what you think, right? So it could help the parents start to work on maybe like better thoughts, better thought process, making relationships healthier. So wow.
Yeah, I think that's a good point, Kat. Like, and if you think about it, it's not just about weight, right? Like, so interesting. So like my son, there have been times where he's negative talk. It's like very common with kids, right? Like they're like, I'm stupid, I'm this, right? And I said to him one day, I met him and I go, don't you talk about my baby that way. And he was like, I am. He kind of laughed. He's like, I am your baby. And I was like, I don't care. You don't get to talk about him that way. And one day I was saying bad things about myself and I was having our day. And he goes, don't you talk about my mama that way. So like they do, it's like you said, though, like they learn by example, right? And so we learn from each other in that moment, So I think you're right. I think that's another way, like talk, or maybe just talk about how you're feeling in general. Those are other healthy habits, right? It doesn't always have to be centered around food. It really doesn't,
Correct.
They're always listening.
Yeah.
Are they ever? I don't have kids.
Yeah. Oh, yes.
Always listening.
Even when you think they're not paying attention, they are paying attention.
Oh yeah. Oh yeah.
I got 3 nieces and they all listen.
From the other room too.
Yeah. Tell me things that I told them when I was like, when they were kids. And I was like, you, what? Wow.
Okay, so I've got another question for you. So if there is a parent out there that is considering a GLP-1 therapy for their children, do you have like a checklist for parents to consider before trying the drug?
Well, first of all, every patient is different. So I believe on individualized medicine. I have a generalized checklist, but I don't feel like every person has to check the box, because this could be a child that has been struggling for a long time, an adolescent. I'm going to talk about adolescents because the GLP-1s are FDA approved for 12 years old and above. We could use it off label younger for, like very extreme circumstances, but the indication is 12 years old and above. So that puts you in almost adolescent time. And if, first, when I see a patient, I need to know what's their social environment, what's their school environment, what's their emotional environment, because all of that, it has to be taken to consideration, because I could put a child on a medication, but if the child has no idea of what foods to put into their body, this is a child that is going to struggle with side effects, that is going to have a hard time, versus a child that has the maturity to understand the difference between healthy food and unhealthy food. Okay, so but there is a child, like a mental checklist, basically, for each patient, and for each patient is different because it depends what's the background, right? Because as we know, obesity is a chronic multifactorial disease. It's not just one thing. So I cannot just look at a weight and say, okay, you're a candidate, but I need to know that you are in the right state to be on this medication, and if you're going to have the right support from your family, from your mom, from your dad, making sure that you're comfortable applying the medication. So But yes, there is definitely a checklist. Yeah.
That's awesome.
Yeah.
I'm wondering too, like when you're trying to make that choice, for your kiddo, it seems like insurance probably plays a big role there on if you can even get them approved. Do you have to go through like with adults, like we have to go through step
Yeah.
therapy and stuff like that? Is that something kids have to do?
So it's tricky, but the insurance approval basically is the same as adult. It's a total pain. And as you know, like even, for my patients, I need blood work. I need body composition analysis. I don't have any child on GLP-1s without being monitored monthly and without tracking very closely their muscle mass and their fat mass and their visceral fat mass, because because it could interfere with growth. If a child hasn't achieved puberty, you could delay growth if you're not monitoring all these things closely. But I would say insurance plays a gigantic role, the same role though that it plays for adult, because the same way adults struggle not getting it insured and then they're, reaching out to other options, I think parents will do actually more for their children than what they will do for themselves. So but it is a struggle. Insurance companies are very difficult. And then for adolescents, we don't have that many options that are FDA approved. So we just have two options, for when we're looking at weight by itself. If we have some other comorbidities like diabetes, hypertension, high cholesterol, or pre-diabetes, metabolic syndrome, PCOS, I could get, one of the other versions also of GLP-1s approved, but it's very tricky, and insurances I think make it very difficult. And also as a doctor that takes care of patients with eating disorders, because a lot of the times now, you do an appeal. My office spends half of the day appealing or doing peer-to-peer. Even when patients do have weight loss coverage, right? And then they put you a block and they say, has your patient been enrolled in a weight loss program? Like, I don't want to say the commercial name, but you already said it, Kim.
Yeah.
Blockbusters. So
I like them greatly.
and then to me, it's like, and this happened to me with a patient that had binge eating and obesity, that also goes to OA and everything. And we all know that patients with binge eating should never belong to a program that they're monitoring constantly, weight and calories. So to me, it was just like ridiculous that I had to go through all this process, that the people that actually are looking at your approvals or your PA have no idea what they're looking at, because my patient should never belong to one of those programs. But yes, we have to jump a lot of hoops, but we get it done most of the time. We advocate for our patients in my office, and because they need help. I mean, a 12-year-old that is struggling with obesity, and most of these adolescents that are already, struggling with obesity have normal values in their blood. So you could just imagine like what would happen if we keep waiting until they become an adult to target this. So
that's what they say, is it keeps getting worse, right?
It does.
Yeah.
So
well, for me,
are children that are dealing with like overweight, are they dealing with what we often refer to as insulin resistance at that age?
Oh yeah. And now we see all these comorbidities that we see in adult, we're seeing it very young. Because also, the world that we're living, a lot of artificial ingredients, a lot of like not natural stuff. So we're seeing diabetes in very young ages, type 2 diabetes, insulin resistance, PCOS. I mean, you name it. All this.
Our food is straight trash in this country. It's garbage. Yeah.
Very young.
What about like with kids that, and I'm saying kids, like everybody understand, we're talking about like adolescents versus children. What about when there are children and there's the medication is not an option, you've tried all the other things, and at what point does like surgery become a conversation for a child that's 12 and up? Or what is the age for surgery for children? I don't even know.
Oh,
Or adolescents.
12 and
It's
above.
12 and up.
Yeah.
Wow.
Okay, 12 and above for bariatric
Yeah.
surgery? Okay.
Bariatric surgery, yes. Obviously, for a child to have bariatric surgery, you definitely have to go through a lot, like a very detailed process, right? Because, like you need to have some type of like understanding and maturity to be able to follow all the instructions and make this be a positive experience. But we do, I mean, like when you try everything, I mean, before it was more complex. Now we have more options of medications that we have accessible that are FDA approved. There's other options, not just the injectables, but the injectables are fabulous. But sometimes we do combined therapy. And because even if we could get, the child to lose certain percentage of their weight, even though if they're a candidate for metabolic surgery, if we get you to lose weight, I mean, most likely the outcomes of your surgery are going to be better, right? And the medication gives you something that, surgery doesn't give you, that neurological and emotional aspect, right? That decrease of cravings, that noise that you have in your head about food,
Right.
and thinking about weight, and not being able to be satisfied also mentally. So that's why the medications are fabulous. I would definitely start with the medication on an adolescent and give them a chance. But they are patients that even with the medications are a very good candidate for adolescent bariatric surgery.
Interesting. I actually didn't even know that was a thing until we started this podcast. And people have been so upset. And I will tell you, even as somebody who has had their life changed by this medicine and dealt with childhood obesity before this podcast, I was like, giving my child no shot. Like and I'm taking it. Right. And I was very sick for a very long time, and I thought that, but then when I started thinking about it, and like, even knowing that there was like surgery and understanding like the genetics of it, and also like the fact that our kids, just like you mentioned, are getting, insulin resistance, PCOS, like all of these different things so early in type 2. It's like, I don't want them to suffer. We should at least have a conversation about the fact that we do have 20 years of data on these types of medications before we do a surgery. Like
Correct.
we should have the conversation. You know what I mean? Maybe that's the first line, as opposed to going directly to a surgery that's altering their body, like Nate was mentioning, forever.
Yeah.
There's no going back. You
No.
can't get your stomach back. You know what I'm saying? Like the lap band with me, I was able to do that. But like, I mean, honestly, I was lucky because mine slipped and it could have eroded and all these other problems, and I didn't have that. But there are, all the other ones, like there's no going back. A medication you can stop taking, or, even though it's hard and even though food noise comes back, still,
And for adolescents, it's very important that first they have the conversation. And a lot of the times you're going to run into your physicians, your primary care physicians, that they don't know much, or they don't feel comfortable, or they feel negative about the medications. And like I said to Nate, good for you for advocating for yourself. That's the right way to go. But that's the same way that parents should advocate for their children, because if your primary care provider doesn't have an experience or doesn't feel comfortable, which by the way, they probably shouldn't even be prescribing it, because this needs to be monitored very closely on adolescents, but they should be able to educate them and referring them to somebody that can. Adolescents should not be treated by, compound medications. They should not be treated by med spas or physicians that have no experience, because
peptide companies.
Oh, hell yeah. And then, so because they're going to experience the same side effects of adults. So you need to, the doctor needs to have a relationship with the patient. They need to be able to explain to them, and you need to monitor growth, because we have seen it. People forget that adolescents are not little adults, right? And then they're not completed. They haven't completed their growth and development. So we do see children that develop, decreased growth, issues, when they start on this medication in a young age. And also you have to monitor that they don't lose too much and that they're not losing muscle, because that's another thing.
Mm-hmm. Yeah.
Gotta get all that
That's
protein.
yeah. Yeah. That's why you were saying, like, they have to be able to take part in what they're putting. I mean, like, I will tell you, as someone that's had with lap band surgery, the small amount that you eat, the planning, honestly, it's exhausting. The planning of the food, the getting in the water, like, it never got better. It's exhausting. Yeah. And like, I can even imagine having a kid go through that.
Yeah, and it's the same, you know.
Kids are way tougher than us guys. They really are. They're like so resilient, you know?
They are. They are. My adolescents do fantastic. And I have to tell you, it's my favorite thing is how you're able to change their lives. You know, you see this transition from kids that like were actually very happy during COVID doing virtual school because they didn't want to go and like hang out with other people. And they wanted to be in their cocoon. They didn't want to socialize. And you see how they start, you know, developing this self-confidence and feeling better about their cells and having more energy, because by fighting inflammation, also you have more energy, you're more comfortable and less aches, you know, because when you're also facing insulin resistance and PCOS, you have no energy.
Yes.
And then these kids do fabulous when they are treated appropriately. Fabulous.
Is the goal with children kind of the same as we talk about a lot? One of the big things with like adults is we say, you know, will you be on this medicine forever? I hate it, but forever, right? To me, it's just like until we ever find out what the next thing is.
Yeah.
You know? Like, you know, so I'm like, forever's a long time. Like someone told me I could have my lap band forever. That was a bunch of trash. Like, you know, so stuff like that, you know, so, but I'm wondering like with kiddos, especially with them growing, like there may be times like based on their growth that maybe it sounds like maybe pull back on the medicine, but is it safe for them to be on long-term as well?
So it depends what's the cost, right? Because when we look at obesity as a chronic disease, if I am dealing with a child that has genetic obesity, that I already have my genetic testing that I know and happens to respond well to GLP-1, we know that it's very unlikely that that person is able to maintain the weight on its own.
Right.
Okay. And then if this is something that it's a combination of metabolism with lifestyle, and, you know, and this patient just needed a push to get everything going and was able during this, you know, several years to actually modify lifestyle and it's used to their new routine, then there is definitely the possibility. And in my case with my patients, you know, we get to the healthy weight and then I switch my patient to maintenance. So I don't necessarily keep my patient on the high weight loss dose. So I start tapering down to a good maintenance dose, right? Because my goal is not like, let's say when we achieve a healthy goal, like not to continue to lose weight, but just to maintain now your healthy weight. And that gives me also an opportunity that if something happens, you know, like different stressors in life, or, you know, suddenly you have an injury and you cannot exercise anymore, or like, you know, anything could happen in life that like it's causing stress and then you're eating more than we always have that option that we could increase the dose back again. So I always bring my patients to a maintenance dose. And I have different ways of approaching maintenance, but have I been able to have patients without medication and maintain their weight? Yes, I have.
That's amazing.
So it all depends. Again, it's very individual because not everybody is the same. So,
I think it would have been very cool as a child if this was something that I could have gotten ahead of at 12, right?
Yes.
No doubt.
What would my life? I mean, obviously, like I am blessed as hell. I have an amazing life and friends, and not this on top of it all. Like I'm just incredibly blessed. But my life was very difficult with weight. You know, the mental piece that came with that, and the social piece that came with it. You know, and like I say this like in a nice way, but like America's kind of gross. Honestly, I think the only reason that I didn't get bullied worse than I did is because I'm cute. If I was unattractive in any way by American standards, I'm pretty sure I don't know, man, it would have been really, really bad. Like, you know, like,
right.
I'm just like, I'm cute.
It's horrible. Like, and then they go to that's back to the beauty standards garbage, right?
Yeah.
But I
That's
just think that,
gross.
like,
Yeah.
I think it would have been nice to be able to get ahead of it. And like you said, like maybe I never hit the, morbidly obese that I did. I don't know if we call it that anymore. You can let us know. But that's what they called it a few years ago. And
I think
it would,
I still
maybe I
use
would have
morbid.
never done that. I don't know. Do they? I don't know.
Yeah, I was categorized morbid.
I'm pretty sure I was grossly morbidly obese.
I think it's just
that's the
it's
old
classes
category.
now, right?
It's old. It's the
It's
worst verbiage ever. Whoever made up that.
We don't like that category. Like those.
It's awful. Why do we even? It's just mean. Just stop it.
Totally. It's, like the same thing when you hear like old school physicians and everything. Oh, this person is obese.
Yes.
No, this person is not obese. This person suffers from obesity.
Yeah.
The same way people have hypertension, diabetes, chronic diseases, depression. I mean, you name it,
You're not an obese person. You're in a person with obesity. Yeah.
Correct.
No more grossly morbidly obese.
No.
That makes me want to go into my chart, though, because I do think they had me as morbidly obese for a while. And then when I lost 60, 70 pounds, I'm officially just obese.
Oh, look at you.
I strive for overweight, and I'm going to stay there.
I just strive for good numbers and movement. Like I
think you're just cat.
Yes. What'd you say,
Nate?
You're just cat.
You're just cat.
Yeah. And we're not a number. Patients are not a number.
Yeah.
Everybody's number is different. And like you say, you strive for mobility, you strive for health, you strive for happiness, you strive that you're able to walk around, that you're able to run without running out of breath. It's about how you feel. Nobody gets to label how you feel.
Yeah.
Yes.
Exactly. It's so true. Yeah. I love it.
We recently had a doctor on with us, Dr. Joy. She's a therapist, and she has documented her obesity and weight loss journey. And she recently had a podcast about her fat family. So she was overweight, her husband and also her children ended up being heavy as well. So we've seen instances where that could possibly be like genetic in that case. And then also instances like say how I grew up, both of my parents were overweight, but my siblings were all Slim Jims except for me. How does that manifest, or how, I guess, I'll just read it. Is obesity truly genetic? And could there be conditions and how it manifests in some people and it doesn't when it doesn't? So that's my question. All over the place. And
it's okay.
I got it.
I think I got it. So there is a genetic component for obesity, even though a lot of people out there wants to say, no, it's not. Yes, there is. We have genetic proof that there is. Okay. And there are a bunch of different disease, and some of them could be genetic mutations, and like you could have the family that everybody's slim, and then just one particular child is completely different from the rest of the siblings. And we know, I mean, like already there's genetic mutations for that. And also, by the way, some of this genetic causes of obesity, there is treatment too. And it is not the same as the GLP-1s, but I like to call it the cousin of the GLP-1, which is actually FDA approved for children with genetic obesity 5 years old and above.
Amazing.
Okay. So yes. And people don't know a lot about that. I guess I have to become better on social media and start talking about these things.
Yes.
But yes.
Do it on TikTok. We'll blow you up.
I know.
I'll repost all that stuff.
Because there are alternatives. So when I see a child with like what I think is genetic obesity, I always test them. I'm not just gonna like, oh yeah, whatever. So, but because yes, you could have that family. You could have the family that everybody, it's struggling with, overweight or obesity. And it could be a combination of genetics with metabolism and lifestyle. Or you could have the family that only has one child, and this child is completely different from the rest of the siblings. And that could also be genetic obesity, right? Because this child probably is exposed to the same lifestyle that everybody else is exposed in the household.
Yeah.
So, and there's so many things, right? So many things that to look at. And unfortunately, this could not be done in a 15-minute doctor's visit.
Sure.
Right? For you to be able to explore of these things, it needs to be a detailed assessment.
Yeah. If a parent wants to find a pediatrician that is specializing in obesity, can you suggest like a resource of where they could find that and hopefully find one like their insurance would cover?
Oh, yes. So you could go to OMA, which Obesity Medicine Association. You could go to their website, and then you could search for, obesity specialists in their regions and pediatric obesity specialists. So there's not that many, but I think in the recent year, it has grown significantly more.
That's good.
But yes. And then, some will take insurance, some won't take insurance. So it really depends.
Yeah. Fascinating. Thank you.
Yeah.
Awesome. Well, this has been a lovely conversation. I do want to make sure that I give Nate the space to say anything else or ask any additional questions if you would like to.
Oof.
On the spot.
It's been a really good conversation.
Snip it,
Right. Snip, snip. Yeah. Shoot.
Got anything?
I don't know that I have anything specific.
Did we cover it all?
Yeah.
Was it that good of an interview? Did we just cover everything?
I was going to say, I think we did good.
Yeah, right, Sabrina? I agree.
I just think it's so important, I think that changing the narrative, and I loved how you said just reframing how we talk to kids and talk about our bodies and our relationship to food. Like we said, they are really listening, and I think that is so powerful that even when we don't think they're listening, or our how we view ourselves is very easily transferable to them. And I think we forget how much power we have over the kids, and how powerful that relationship is with them. And I think it is important to realize that a lot of parents are doing the best that they can, and in the same breath, I think it's just so important that we remember how precious they are, and it's the demographic that I work with in my professional life, and so I just feel very passionate about making sure that kiddos are getting the best care that they can, and I wish that I could have had this 20 years ago, or 30 years ago, and so I'm so glad that there's people out there like you that are fighting the good fight and helping kiddos not have the experience that I had, and that they can live free and have hope and excitement and full mobility, and to live a free and mobile life, and to not worry about the food that's going in and worry about gaining weights is it's something that I haven't experienced yet, but
we're getting there.
You're able to give that to kids is absolutely incredible, and thank you so much for all the work that you're doing, and I'm excited to continue to follow you and to see the work that you are continuing to do. So
me too. See, aren't you glad I asked that question?
Yeah.
Was a good answer.
I'm so glad they invited me on this episode, and It's kind of funny that, it's something that I've really struggled with, throughout my whole life, similar to all of them, but also it's, I see it in my work all the time. I'm in surgery for kids. That is my everyday. And, I see kids come into the hospital every single day that struggle with these things.
Yeah.
And so, it's something that I'm very passionate about. And, so
Yeah.
that's kind of just, it seems so fitting that out of all the podcast episodes I could have been on,
I mean, that
it
was by
seems
design, you know that.
very,
Right.
oh, of course. Yeah.
That's
The fact that I was telling my
good.
story while I was at work,
Yeah.
and you guys just happened to be there as well.
Yeah.
So
That's
it definitely
awesome.
it felt meant to be. So
Definitely.
Awesome.
Awesome. Well, this has been a lovely conversation, everyone. I appreciate you so much for
yeah.
contributing to the movement and the story and to help others. We get messages every episode that says, "Hey, that sounds like me. I'm going to go see my doctor." And that's what
That's
we
so
want,
awesome.
right? That's what we
Yep.
want,
Yeah.
because there is help out there.
There is.
And I have such hope for the future as it, pertains to these medications in children, because like I remember
Mm.
it's hard. It's like
It's
I,
hard.
I remember when Dave and I were very, very excited the day that Manjaro got approved, and we had Zepbound, right, for
Mhm.
obesity, because he and I both have a very large genetic component, pun intended, and have children. And Dave has type 2 diabetes, and we don't want our kids to have it. We don't want that, but there's what, like 70% of it we can't control. Like,
Mhm.
the rest I think is, food and movement. And, I think it meant so much to us when that happened, because I just have hope that so much of the torment and, physical pain and mental pain and anguish is something that maybe our kids won't ever have to suffer now,
Mm. That's
So,
powerful, Kim. It's powerful.
yeah.
Yeah.
So I hope that is the way things go, but it's just nice to have hope, isn't it?
Yes.
It really is.
Yes.
And I think what
Yes.
I'm pulling from you, Dr. Dina, from this whole conversation that we're having today about pediatrics and obesity treatment, it made me think of an analogy. Whereas when you're on the plane, you have to put your oxygen mask on first before you can save your children.
Mm.
And so,
Yep.
take care of yourself up here, nutrition, just take care of you, be kind to yourself so you can
Yeah.
show that to your children to be kind to themselves as well. So,
Yes.
100%. And that's
Yeah.
for everything in life, right? You have to take
Yeah.
care of yourself first to
Uh-huh.
be a better caretaker.
Yes.
Yeah.
Very
Fire.
true. Very true.
Yeah.
Awesome. Okay, well, I will exit you guys backstage. Thank you so much for coming.
Thank
We
you,
are now going
guys.
to proceed to talk behind your back. So have a lovely evening.
Bye.
All good
Thank you.
things. All
Thank
good
you so much,
things.
guys.
Thank you,
Oh,
guys.
thank you.
Bye. Thank you so much, Dr. Dina. Thank you so much, Nate. We appreciate you being so brave
you,
and
guys.
honest.
Thank you.
Have a lovely night. Oh, yay. That was great.
That was a great.
Right?
Yeah.
That was some good
awesome.
information. I think people will like to have heard that, don't you think?
Yeah.
Yeah. Oh, yeah.
I do. And I think I think understanding too, I think their insurance piece, of like how this works, is something that a lot of parents don't understand. But I think it's interesting. She's like, we get it done. Like, we advocate for our patients, and for the most part, we get it done. And I think that's really interesting. And I think, as parents, we need to think about that if we're ever in that situation,
Yeah.
And it's Ren, so like my son is 11. I'm like, a year from now, what's that going to be like? And I do find myself, I'm working on it, looking at his body
Mm.
and as it forms and shapes, right? It's not bad to pay attention, but I catch myself like, don't you say shit. Don't you say a word, right? Like, you just
Yeah.
focus on. And I loved her tip about let's do this together as a family. So even though I have one child, like, I think it's kind of cool to be like, why don't we go out and do something with our bodies today? Right. Maybe that's the language, right? Why don't we go out and, we can do this, this, and this, and, we'll have a nice meal, and then maybe afterwards we'll go and kick the ball around, or maybe we'll go,
Yep.
you know what I mean? Like,
Yeah.
or we'll go to the playground, or, and, or like, even when you want to play video games, maybe we don't sit at home, maybe we go to the arcade because we're
Yeah.
moving around the whole
Mhm.
time, right? Something like that. And we discuss why we're making that choice,
Yep.
right? We're doing this to move our bodies, to
Mhm.
exercise our mind and our bodies and enjoy it. And of course, we can have some froyo after if we want to. Like, there's
Yeah.
nothing wong with that. No
I think
restriction.
it's
The
I think
puppies
it's definitely
too.
important how you
Healthy
frame it.
lifestyle. It's
Yeah,
not, it's not
I think
healthy
it's how you frame
food.
it.
It's healthy lifestyle, right?
Yeah,
I think
yeah,
that's important. Yeah. Anyway, such a good conversation. It really
yeah.
was. Anybody got
Wow.
any good NSVs this week before we close out? Or words of wisdom? We can do either.
I'm trying to think about it,
Oh
but
my gosh, I've been so rushing and rushing. An NSV. I shared it on Sabrina's live, but I can put my pants on without leaning. I can just hold one leg up.
That must be nice.
that's got to be that's a great feeling, right? Because I
Yeah.
could never do that. Like I had to sit to put everything on.
Oh, I'll fall right over. I got no balance.
Shoes, socks, pants, everything.
Yeah.
You
Yeah.
should have like
That's
all your core
cool.
strength, because your husband's been like, "Whoop-cha," and working his butt,
Whoop-ah! Whoop. In the
just to
gym.
see how strong your core is, because it's also the balance the core. Like I'm like, wow, I think it's not only the weight loss, but it's like the muscular strength. You
Yeah.
start, especially you, Kim, when you're doing that kettlebell, your abs are
Yeah.
gonna start being like super.
I think it's helping my Manjaro butt.
I'm going.
Oddly. Listen, it's a thing. It's a thing.
I
There was a lot of flab in that ass, and I'm telling you, it's more deflated now, and I need something to hold it up. The muscle's got to get stronger. I
I
didn't
was like,
need
where
them.
are those bands?
Yeah, I got them over here. I got bands, and I have my kettlebell. Look at that big
Okay.
old kettlebell.
Let me see the big kettlebell. That's what she said.
Isn't my
Oh, it's a nice
kettlebell?
color too.
It is big. It's 6 pounds. 6 pounds. There's an 8-pound one. I'm starting. I don't want to break myself. It's
Yeah.
good. It feels
Slow.
good. Yeah, I like
Oh,
it.
I love kettlebell workouts.
Yeah. Yeah. Anyway, well, that's good. What about you? What you got?
I can't think of an NSV right off the top of my head, but
That's okay. What about
my
words of wisdom?
my words of wisdom that I just recommend to everyone and say all the time is set realistic expectations for yourself and show yourself grace, because
Yeah.
we've spent too many years not doing that, right?
So true.
So be
So
kind to
true.
yourself.
I love it. Yeah. There's so much with that. It's like I feel like I still have to tell myself that every day. I tell other people that every day, but I still have to say, like, I think that's the difference, right? There was that I can say it. Like, I can stop and gear shift and go, what am I doing?
Yeah.
Like
Mhm.
right now, my weight's up, right?
Mhm.
And I'm starting 15, and but I'm like, why am I upset about this? Every human has up and down weights, like
Right.
regardless of what kind of journey that they're on. You
Mhm.
know what I mean?
Mhm.
Like, everybody's weight fluctuates. That's why people, regular humans that lose weight, always try to lose more, because they know that they're going to fluctuate between like a 5 to 10 pound range.
Right.
And I find, like, even today I was like, I'm not getting on the scale. I've gotten a lot better about not getting on the scale. I feel like that might be my NSV. Like, I've just
That's
gotten a
good.
lot. I was like doing it all the time.
Mhm.
And I'm
Yeah.
glad that I started out weighing every day when I got on Manjaro. That was the first time I did that, because I learned what my like true weight was, like my true north, right?
Mhm.
I was able to kind of track, oh, okay, this is when my weight is the lowest. And it was like the same time every month, and I still have a cycle. So I was like, oh, okay. So like 2 times a month is when my weight is lowest. And it's always the same. So that's my true north.
Right.
That's my weight, right?
Mhm.
Everything else in between is just like
Inflammation,
arbitrary, like
water,
inflammation,
all the things.
poop
Yeah,
is the
all
thing.
the
Poop
stuff.
is heavy. Yeah,
Yeah.
inflammation, water, poop, like all the thing, right?
Yeah.
A big old meal, a burrito belly, like, it's like,
Right.
Yeah.
Right.
I think that's something that, like, I'm glad that I did to learn, but I don't have to do it anymore.
Mhm.
I think something that, like, I've struggled with and I've talked about on TikTok is trying not to sabotage myself. which I think go back to like giving myself some grace, right?
Yeah.
Is like not being because I am a 14, 16 right now. One more size down, that is not plus size.
Like, holy cheese. Unless
And I
you
know
order them from like tiny little like spots that
maybe.
order their clothes from China.
Sure.
Because
But
I ordered some
regardless,
leggings from China.
it's
I
weird
didn't know
though,
they were from
right?
China, and they're so little.
Yeah. Okay.
Like
Well,
the
I'll do that.
waist
Try
is
to help
like
myself
this
with
big.
that.
I'm like, how is this so large? I'm like,
Yeah.
Yeah, that's definitely different sizing.
Yeah. But like I've never been small. There's not a skinny Kim in history, and
Yeah.
to me, anything smaller than that is middle school Kim, which means that's child size Kim as an adult. And the mind connection of that,
I was going to say that's
right? And
heavy.
think about that's
Mhm.
childhood obesity, right?
Yeah.
Like that's what we've all been talking about. So
yeah.
that's a lot. And I'm trying to
That's
kind of work through that. I think it's going to take some time, but I am finding that I'm doing like what you do when you get to a goal weight where you kind of take some liberties. You know what I mean? Like, I'll have a couple more chicken wings. You know what I mean? And it's not because I want them. I think I'm sabotaging things a little. You know what I mean? And so the good news is that I'm actually recognizing it though, right?
Kim, you're singing my song because I've done that
Right?
before. I mean, I
Yeah.
lost 95 pounds and I mean, I've done 95 pounds, but that 5 pounds, I was like, I started to sabotage myself.
Yeah.
Like, I know
Yeah.
exactly what you're talking about.
You get
Yeah.
really close.
Yeah.
Yeah.
And it's like, I could probably stay here. I'll be fine. I don't need to lose any more weight. It's all right if I gain a little. Like,
Start
I do
gaining
that.
things.
Yeah. Like, I do that. And so I'm trying to
Oh, yeah.
like
Me too.
not. I'm trying to not. But the difference is, I think this time is that I'm, like I said, like I'm recognizing it. It's back to like, I feel like before the medicine, I just sort of zoomed by all my thoughts. You know what I'm saying? Like, and now I can be like,
Yeah.
like, what does that actually mean?
Wait
And
a minute.
yeah,
Yeah.
Kim, what are you doing to yourself, crazy brain? Stuff like that.
Yeah.
One thing I forgot to ask her, I kind of had thought about it, and I may do a follow up, but is, we're talking about families and how there are these children, and like why, when you're sitting there, whether it's genetic or not, like you may have, like, say it's me, and we have the same mom, we have the same dad, and yet we're all eating the same foods, and we all have some sort of physical activity that we do. Eat less, move more.
Yeah.
Why am I gaining weight and they're not? Right? Like, what's going on there? Like, and is it just genetic? Like, doesn't seem to make much sense. I wish I feel like I didn't dig into enough on that one. That's okay. Part 2. Go to part 2.
Another part too.
Yeah. Kat asked something that was kind of similar to that, like, why does one out of all of them, and
Yeah.
it was
Why did
the
I have to be the big one?
Yeah.
I'm just kidding. I have learned to really love it. But yes,
Yeah.
I feel the same way with Kim though. Like I'll have a get loose and wild and free weekend. Okay. I'm fine. Yeah.
And that's okay, right? Like it's fine to have that, but it's just like all the time we've lost weight and we've gotten to our goal, and it's all right to do this. It's okay to add this, but is it? Are you at your goal? Like, I still don't have a goal, but still,
Yeah, like, is that diet culture saying, hey, wait a minute? Like, all the thoughts. Yeah.
Yes,
Yeah.
exactly. Awesome. A lovely episode. It will be in 2 parts. That's what we're doing these days because they're long.
They are long.
Yeah, but that's
And
okay.
our attention spans are short.
God, because we come from TikTok. We're like, you know what? The vices on TikTok is saying the most important thing in the first 5 seconds because people don't stay on it longer than that.
Yeah.
Yeah. But yeah, TikTok's like, oh, make longer content. Why?
Yeah, you got to be touchy. Like, you got to go right out the gate. And
although the viral was like 5 minutes long.
Oh, that was that long one. Yeah. The PR one.
The one that went viral. Yeah. The PR one. Yeah. And people are still like, oh, Kim's making her, sorry, it's going to happen. Kim's like growing her platform off like Weight Watcher stuff. That had nothing to do with Weight Watchers. There never. I didn't even talk about it.
What Oprah was doing. So.
No, I legitimately, all I said was, hey, that's a bullshit narrative. How about you help us find a new one? And then I talked about insulin resistance and what we've learned from the doctors.
Yeah.
It's not things I haven't said a million times. It's just, that's the one that caught fire. That's it.
Right.
Crazy. whatever.
algorithm,
More
yeah.
people know. More
Yeah.
people know. And that's what I always said I was going to get loud. It's just, I have to get very loud.
Mhm.
You know, everybody will deal. It'll be fine.
Heck yeah.
Anyway. All right. I got to pee like a racehorse because I drank all this water. So, hasta la pasta, and we'll see you next week.
All right, friends.
You're
Bye,
gonna listen to
everyone.
our
Outro.
outro. Yeah, that's it. Interested in understanding GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Then join us on the Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, or Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together, because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone. It's not your fault.